It's kind of a personal story, and it's really hard to talk about it now. But sometimes we have to push ourselves to help others, right? Isn't that what doctors do? It wasn't my first patient. It wasn't even my 10th, even my 100th. As I remember it really clearly now, it was just your average evening in the hospital. I had to see a patient in A&E. Her name was Ellen. She was breathless, and when I listened to her, I heard a sound that's a characteristic of heart failure. To me, it seemed that my diagnosis and the treatment I administered would be sufficient. She was under our supervision. It was completely as intended, and her recovery was textbook. She felt better. It was a win. So I sent her home, and you know what? I felt really good. And that's when I made my first mistake. I sent her home. Name someone who dies, you never forget. Her name was Ellen. Time and time again, I rethink it, and I think about it. I think about it all the time. I've tried to forget it. I even considered leaving the profession. But all I've done is work myself almost to breaking point. The wound just did not heal. Years later, I found myself in depression. And only after therapy with a psychologist did I really understand what I needed. I want doctors to be more respected. I mean, I think we already are. But what if society really needs a new medical culture? One where doctors are not afraid to hesitate in asking for psychological help. A culture where this is perfectly normal. So, we launched a service for doctors. The service where they can register and they can get help from psychologists. You see, just like everybody, all people in all professions, doctors need help and access to a wide range of support. And of course, it's not just about work. We burn out. We have families and personal concerns. Doctors are superheroes, but even superheroes make mistakes. So my goal is to help doctors share their experiences and, support those who are afraid to admit their mistakes. I really hope that this will help society to evolve, to humanize it. I've tried to forget it. I even considered leaving the profession. But all I've done is work myself almost to breaking point.
I worked for 30 years of my life. I saw that, I saved lives, that's what's important.
Traditional medicine helped our people thousands of years, but now we need new solutions.
Actually, I believe they'll be more like us and we'll do it more efficiently together.
All these startups, we are not successful for various reasons.
Where I've learned that unity, love, and support conquer it all.